Okay, I want to come back to the diet now and highlight a couple of the pieces there that we didn't get into specifically. No gluten, no dairy.
Correct.
So talk about why those are important.
Dairy products, and whenever you have a difficult question like this, go back to evolutionary biology. We evolved over millions of years eating, a particular diet. And those foods only came into our diet in the last maybe 10,000 years, which in terms of evolution is the blink of an eye. Now, the problem with dairy products is that dairy products evolved for young mammals. If young mammals don't grow very quickly, then they get eaten by saber-toothed tigers. So all dairy products, or beg your pardon, all dairy products except butter contain milk protein, which is growth promoting. And that makes the risk factor for cancer. Lovely book written by Jane Plant, who was a geologist at Nottingham. In her early 40s, she developed breast cancer. She had the surgery, the radiotherapy, the chemotherapy, ended up with a plum-sized lump and told 2 months to live. She read that in China, no dairy products, no breast cancer. So she took out dairy products and she watched that cancer melt away and disappear. She wrote a book called Your Life in Your Hands. Her name was Jane Plant. She also went on to write the plant diet, but she didn't get the carb bit because we know that sugars and carbohydrates feed cancer. Anyway, she survived into her early 70s and actually died as a result of the chemotherapy. But it's just an illustration that dairy products drive cancer. They're also a risk factor for heart disease. Lovely paper, The Cow and the Coronary by Margaret Moss and David Fried illustrates that point. They're also a risk factor for osteoporosis because dairy products have got high proportion of calcium to magnesium, which, yes, is very desirable for the growing baby, but not for the adult. Calcium and magnesium compete with each other for absorption. So if you're having a lot of calcium, you'll block your magnesium absorption, and that is a risk factor for osteoporosis and heart disease as well. And again, dairy products are common allergens. At least 30% of the population are allergic, and dairy products are number one allergens. So the only safe dairy products from a nutritional point of view is butter, but many of the allergics actually don't tolerate butter. So that's why we have to be careful with dairy. And then gluten grains. Well, gluten, the number one problem with gluten is it's a very common allergen. And if you've got any allergic symptoms like irritable bowel syndrome, intrinsic asthma, migraine, temporal arteritis, urticaria, eczema, any of those conditions are often driven by gluten allergy. But I went to a conference recently, and the consensus of the conference was that gluten grains should be animal fodder only because they have been bred, genetically modified to have a very high level of gluten in them, which the cooks love because it gives it that, that texture, that glutinous thing. So you can make, very good, phyllo pastry and all that. But it's great for the cooks, but not good for us to eat. It's high in lectins, and for many people, lectins are toxic to them. And it's often high in pesticide residues. So gluten grains are usually out. If you're absolutely 100% you're not allergic to them, then the occasional, organic, GM-free loaf would be fine. But again, it's going to be high carbohydrate, isn't it? So that's another issue. And another interesting point is that allergy and addiction are two sides of the same coin. So you have to apply the Myhill addiction test. So if you have a slice of bread and you're not happy with that, you want another and another and another, it's not for you. It's the same with cake and biscuits. You have a slice of that and you can't stop, it's not for you. So and I say I can't. I'm a horrible addict. If I have a taste of something, I want more. So I just have to say no to the first taste.
So that doesn't happen for you with the linseed bread?
No, not at all. I have a couple of pieces and I'm full, I'm satisfied, I don't want any more. So no.
How do you look at fats? You brought in butter, and it sounds like depending on how your constitution is, that can be okay. But talk about things like tallow, other animal fats, and then some of the quote-unquote healthy plant fats like avocado oil, olive oil, and how you think about all those.
Fantastic. They're all good. I mean, in nature, there is no such thing as a bad fat. They are all good. And we have two types of fat, don't we? We have the saturated fats. Now, saturated fat is a carbon chain, which might be a long carbon chain, which is straight. Think of it as my arm. It's absolutely saturated with hydrogen ions, and that makes it very tough. So when you heat it, it stays, it retains its shape. When you cool it down, you can use it again. And of course, it's the perfect fuel for the body. And then we have the unsaturated fats. Now, the thing about the unsaturated fat is they're missing a hydrogen ion, and that gives them a double bond between a carbon and a carbon. So they're kinky. So an omega-3 is kinked at the omega-3 position. An omega-6 is, polyunsaturated omega-6 is kinked at the omega-3 and the omega-6, and sometimes they're kinked somewhere else. So in nature, they're all boomerang shaped, and they're all left-handed fats. But if you hydrogenate them to make margarine, or you cook with them, some of them will flip into a right-handed fat. And the trouble with that, that's called a trans fat, and it doesn't fit biological enzyme systems. It's like trying to put a right-handed glove on left hand. It doesn't fit. And they are the dangerous fats. So oils are wonderful foods, but they must be cold pressed and organic and not hydrogenated. And you have to shop around a little bit for cold pressed, organic olive oil, because they'll tell you it is and it isn't. So you have to be a little bit discerning and find a trusted source of olive oil or whatever oil it is that you want to use. But many sunflower oils, rapeseed oils, are mass produced. They're heavily contaminated, and being a fat, the pesticides, concentrate in them. Or they've been processed either in ultra-processed foods or by cooking or by hydrogenation, and they're full of trans fats. So as soon as man gets in the way, the oils have the potential to become unsafe and unhealthy.
Okay, it sounds like it, but further clarify your thoughts on vegetable oils, seed oils. It sounds like you're against them.
I'm against them.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
The upper fermenting gut is a major, major problem. It goes almost unrecognised by the conventional doctors. We have to get rid of the upper fermenting gut. And yes, there's a two-pronged approach. Yes, we starve them out with a low-carb ketogenic diet. And secondly,